An American medical team is on the ground at Gaza's European hospital, the last medical facility in Gaza able to treat trauma. U.S. doctors have been volunteering there to treat patients, but now they're finding themselves unable to work and unable to leave. Dr. Ismail Mehr went into this hospital to help and returned at the end of April. Since then, the invasion into Rafah has started. When he was there, conditions were already tough, but the situation has become more dire. He is in touch with his colleagues and is able to give us a snapshot of what it's like to work there and what he's hearing about the conditions now on the ground. Dr. Mehr, thank you so much for joining us.
Thank you for having me.
Can you start by just telling us what it was like to work in those conditions?
You know, I've been to Gaza many times before. This was my fifth time there, but first time in a war and situation like this. And the conditions, you know, the healthcare system is always struggling in Gaza, you know, since the mid-2000s, early 2000s, I should say, since the embargo took place. It's always a system that is struggling. It's never complete because of all the issues around the geopolitics in the region. However, now you throw this mass war, mass casualties and mass bombings and strikes on a continuous basis for the last 200 days, and you have a healthcare system which was already collapsed and now is just struggling to stay afloat. We work alongside many local physicians and amazing people, from nurses, technicians, to doctors, to medical students, who have been working nonstop for 200 days and just trying to help their people, trying to help save lives. But without resources, without medicines, without equipment, without knowing when you'll get supplies, it's a challenge like no other.
I imagine it's also dangerous. So there's a lot of fear, given that relief workers who have been killed in Gaza. You know, what was it like? You know, dealing with that reality of potentially coming under attack yourself?
Yeah, I mean, definitely. I don't think as a team leader, you know, with the Imana and also with Heal Palestine, it was a partnership project. We went in. I was asked to be the team leader due to some of my experience, I assume. You know, the focus was on safety and security first and foremost for me, and worrying about my teammates. But you don't go into a mission like this if you're not ready for the consequences. And I've said that. I've had many healthcare providers across the range of specialties and levels reach out to me like, I want to go. And I talk to them really. And I say, you know, Gaza is not for everyone. Just because you feel like you need to be there, you feel like you want to do something for these people, it's not for everyone. We were awakened in the middle of the night, every night, the 9 days we were there with bombings. We were very quick to be able to know what was a drone strike, what was an artillery fire, what was a jet dropping a bomb. You know, we were present. Now, was it very close to us? Hard to say, you know, but the Gaza Strip's not very big. And when your room shakes, it's close enough. But like clockwork, we knew that was our need, that was our time, that was our calling to get to the emergency room as the mass casualties would come in. And literally within 30 minutes, the bodies, which were the dead on arrival, the children, which were injured, the mothers, the fathers, the families, you know, would come in wholes. And that was really something I'd like to emphasize. Like, people would come in groves as whole families and neighbors and so on. Like, that's my neighbor who just died, or that's my uncle who was in the house next door. And we would get to work and work through the night trying to stabilize and save patients. And we lost many as well.
Can you speak to the kinds of injuries you were treated and what the kind of failure to get the right sort of tools means in terms of fatality rates from injuries that might otherwise not have been fatal? There has been reporting of doctors having to do amputations without any form of anesthetic. There have been reports of people dying from preventable ailments like not having diabetes medication or UTIs, and obviously the lack of food, the famine that is now present in Gaza is also something that is imperiling people's conditions. Can you speak to that?
Absolutely. You know, I think the first thing that I saw and that we all saw as team when we entered was the number of amputees, the number of amputations, the number of children to adults missing one limb, missing two limbs. It was everywhere you look, if you don't see someone missing a limb or missing both limbs, to most of the time lower extremity, you weren't in the right place. You weren't seeing what rest of us were seeing. In terms of taking care, so this conflict's been going on for 200 days now, 200 plus, and you have waves of death in conflict medicine. You have those who die immediately from the blast, from the strike. Then you have those who die a few weeks or a few days afterwards because not able to get access to healthcare, not be able to be operated on appropriately, not being able to be taken care of. For my colleagues, I've worked at Shifa Hospital many times, and my colleagues who were there that I met at the European Gaza Hospital had come down there now to help and continue with the resilience of the Palestinians to help and try to strive to take care of one another, shared with me the horrific stories of exactly like you said, amputations being done on the floor in the emergency room or the hallway without any anesthetic when things had completely run out. While I was there, we had supplies. We had brought in almost 2,000 pounds, a ton of supplies ourselves for our 4-person team. So I wouldn't say we were adequately supplied, but we had more than what they had months prior. Very important, though, is as you mentioned, what people are missing and forget is the voice of those who are dying every day because of lack of access to healthcare. When you and I get sick, we can simply call up our doctor, go to the office, go to the urgent care. Gaza, despite being a struggling healthcare system all throughout the last 2 decades, still had a healthcare system where you could go see your physician, get your urinary tract infection taken care of, get your infection in your ear, get your tooth infection. We saw so many abscesses and dental disease that has led to meningitis and leading to severe illness and severe morbidity and mortality, simple things like that. But every day I had to pronounce people dead in that emergency room who were dying from very basic, simple things. The grandmother who did die of a urinary tract infection. You mentioned UTI, and I exactly had a patient. I had to run CPR on her while her son watched. And then I had to put my arm around him and tell him that she passed away. It's like, they told us all she had was an infection, but they had no antibiotics to give her. They had nothing to give her. And every day there are people dying because of lack of access to basic health care.
What is it like trying to enter the region, trying to work with the relevant authorities to get your supplies in?
It's a process. Getting into Gaza and all times is typically there is a process and procedures in place, and I will credit the WHO and many agencies worked diligently and put together a system. The process is. Would I say it's easy and straightforward? No. Is it challenging? Yes, but there is a process and years of experience in healthcare relief as an organization, and the organizations that are going in, allows you to understand how to maneuver that. And you have to work with the Egyptian authorities, get approvals through the Ministry of Foreign Affairs there. Then you have to work with the Israeli officials. You have the WHO, which is facilitating a lot of these approvals and discussions in between. But you don't know if you're going to get in till you actually walk in. I think that is very clear. I think anyone from any organization or from anywhere around the world who's been recently to Gaza, you don't know. You can get to Rafah, and you don't know until you actually walk across and enter into the Palestinian side if you're going to get in. And it's a big sigh of relief because we spent an entire day going through the process as we arrived, and it took once we arrived at the border at Rafah, we waited for 6 hours before we actually walked across.
Yeah, The Intercept did an interview with a doctor, Monica Johnson, also at the European Hospital, I believe, earlier this week, and she was talking about how difficult it is to replace doctors. There are doctors that have been there that would leave but don't want to leave before there's a guarantee that they can be replaced by other doctors. They don't want to abandon the patient population there. But there's some concern about whether or not new doctors will be able to be safely brought in because of how many humanitarian aid workers have been attacked. And she told The Intercept that they were doing a trial run on Tuesday of just UN workers driving to the hospital. And if they were able to make it safely, then they would try another run with the doctors. I mean, that's a really gruesome reality to think that you're unable to bring new doctors in because you're concerned not that they are going to be killed in crossfire of a war zone, but that you might potentially be targeted by the government with whom we are allies and who we are funding in this conflict.
Yeah, I mean, 100%. Yeah, so I am on part of the WHO emergency medical team, coordination cell, communications, a lot of verbiage there. And yes, the UN did have a trial run on Tuesday. It was successful. However, subsequently, no medical team has entered. The coordination and approvals has been challenging on that part. I'm not intimately involved in that, but I do receive the updates from the WHO and other pertinent authorities. Which means that the Fajr Scientific team, which is based out of Texas, and the PAMA team, which is the Palestinian American Medical Association team, that's about 20 U.S. physicians, nurses, doctors, people there right now in Gaza. They are not exiting anytime soon. And, you are an open target. I think that is very important to understand as you go in. And that's why I do say to people, Gaza is not for everyone. Like, people want to assume there's relative safety for being a physician or being an American. You have to understand you are going into a active war zone, more so now than when I entered. I mean, when I entered, it was an active war zone, but at least Rafah was not under attack at the time. Now that Rafah is, it is a danger that you're going to take on, and it's very relative danger. Like ourselves, our teammates, all of us, we all re-updated our wills before we left. I don't think we shared that with our families, but we made the conscientious decision and knew what we were getting into. I think part of it is experience, part of it was just really, as an organization, understanding what we were going into and understanding Gaza.
And just so we understand, this European hospital, it's in Rafah. It's one of the last, maybe the last trauma center standing in Gaza. You said you previously worked at Al-Shifa hospital, which has obviously been subject to multiple rounds now of IDF attacks. Does that mean now that if the last standing European hospital now in Rafah is unable to get new doctors to it and presumably new supplies to it because Rafah is now under siege, that there's basically no access to a trauma center anywhere in Gaza?
Absolutely, and just to sort of put it on a map. So European Gaza Hospital it's not in Rafah actually. It's very close to Khan Yunis. It's in the outskirts of Khan Yunis in an area called Al-Fuqari. So you're talking almost close to the central of the Gaza Strip. It is it's not a massively large hospital as we would think as a major tertiary healthcare center. That was Shifa, Nasser, Indonesia, some of the other hospitals that you've heard of that are no longer, that have been eliminated. European Gaza Hospital is the last larger tertiary hospital remaining. And I've been in contact with the physicians and people, local Palestinians there. They're about to run out of fuel. I think very limited amounts left. So they're going to run out of that. They're going to run out of supply. And even while we were there, and I was sharing with you, when Rafah would be hit or Khan Yunis would be hit, there is no trauma centers in Rafah. There's 3 smaller hospitals there. Al-Najjar, which I think many of the reports have shared, that has shut down and relocated. There's a Kuwaiti hospital, and there's an Emirati hospital, which is primarily maternity. That's in Rafah. Rafah does not have the facility to take care of trauma. Even while I was there, all the trauma would come by ambulance about 7 to 10 kilometers, probably, maybe a little more to us at European Gaza Hospital. That's why when there was a strike in Rafah, we'd hear it, we'd feel it, we'd shake, and then we'd know it'd take about 30 minutes before the ambulance would start pulling in. And the access to healthcare for these casualty traumas is already in dire conditions because they have run out of supplies. I've talked to people there from some of the American teams that are there and some of my Palestinian friends who've stayed there. So it's going to be a dire situation. On top of that, let's not forget the pneumonias, the infections, the premature baby. Let's not forget all the child with cancer that can't get his chemotherapy. I think these are all things we forget. We focus on the sexy, or not a good term here, but we focus on the bombings and the blasts because it's big and it's you can visualize it. But let's not forget there's hundreds dying every day from very basic healthcare needs that are not counted for.
Oh, well, we so appreciate you joining us today to explain some of that. Thanks so much.
Thank you so much. Bye-bye.